Everybody sit down. All right. Can you call the roll, please?
Senator Saslaw, Senator Barker, Senator Donovan, Senator Suderline,
Yes.
Senator Lewis.
Here.
You have a quorum, Mr. Chairman.
All right, good enough. We've got a sign-up sheet. We'll follow the sign-up sheet. First one up is Delegate Hope with HB 1193. Yes, sir.
The committee, you've seen a similar version of this before. Senator Morrissey passed a bill out of here that directed DMAS with DBHDS to create a board to evaluate and make recommendations for early
Is
psychosis.
yours identical to his?
It is
No.
only, there's one distinction is his creates a permanent board which has a fist to it, and he's in the Appropriations Committee trying to sort that out. Mine is a work group, so there's no cost to it. I think if we were able to pass both bills, we could conform them, and when whether his gets funded, then his would be the vehicle. If his doesn't get funded,
Okay.
then mine would.
Okay, so a roll in would not be appropriate at all?
No,
then?
sir.
Okay. All right.
But that's the
That's
bill.
it?
This
Okay.
is the workbook. Everything else is identical.
And
to
I
what you've
remember
already-
Senator Morrissey's bill. Does anybody on the subcommittee have any questions of Delegate Hope?
Mr. Chairman,
Senator Suderline.
the work group sounds like the better option.
Probably is because it doesn't cost anything.
Do I hope, am I correct?
Well, it's my version of the bill, so you would be correct, Senator.
Mr. Chairman, I think we ought to try to support this version of the bill. I think it's preferable.
I believe the horse is out of the barn on the other version, though, I think.
Well, sounds like, isn't it in House Appropriations? I'm not sure it will leave that barn.
I think that's why Delegate Hope wants to get this out of here. So, does anybody speak in favor of House Bill 1193? Anybody speak against 1193? Is there a motion on 1193?
Mr. Chairman, I'd like to recommend that we report House Bill 1193 as it currently is before us.
All right.
And if there ends up being differences, the governor, if they both find themselves lucky enough to get there, he can sort it out. But I like the way that Delegate Hope's proposal doesn't cost additional money.
All right. Is there a second? All right, there's a second. It's been moved and properly seconded that we recommend to the full committee reporting House Bill 1193. Call the roll.
Senator Saslaw, Senator Barker, Senator Suderline,
Yes.
Senator Lewis.
Yes.
Ayes 4, no 0.
All right, Delegate Hope, pleasure doing business with you. Next up, we have Delegate Byron. She was just in here a second ago. All right, I'll skip over. She'll get back in a minute. Delegate Davis.
He's also not here.
Everybody's AWOL. Like how much on his way back? Like elevator way back or hallway?
Like he's walking.
Okay.
Delegate Delaney's here.
Yeah, but I'm trying to follow the sign. There.
You don't have to pause. I'll just tell him.
Okay. All right. Delegate Adams. Let's keep the train rolling.
Thank you, Mr. Chair. Members of the committee, I believe we have an amendment in the nature of a substitute.
Okay. Can somebody move the substitute?
Move the substitute.
Moved and properly seconded that we adopt the substitute. All in favor, aye. Aye. Substitute's in front of us. What's your bill doing here?
Yes, sir. So HB 241 basically has the State Board of Medical Assistance Services to include a provision in the state plan that allows for the payment of certified rehabilitation equipment, including automatic wheelchairs, to a qualified patient in a nursing facility. And this is important because decubitus ulcers cost about $11 million a year nationally, so ill-fitting wheelchairs, randomly using other people's wheelchairs can contribute to that. Mobility is a really important part of independence and health and wellness, and that's why these are particularly necessary. I do have somebody from the community who is here to speak to that if you'd like them to.
Sure. Any questions from the subcommittee for Delegate Adams? Anybody speak in favor of House Bill 241? Yes, sir.
Yes.
Sorry.
Good afternoon. I appreciate it, Chairman and members of the committee. I'm Richard Bagby, Executive Director, United Spinal Association of Virginia, and we firmly support this bill, not only for the independence of folks and their health, but also we believe it'll save a significant amount of taxpayer dollars. So I appreciate your support on it.
All right, thank you.
What does a motorized wheelchair run, basically?
It varies based on different needs, based on different levels of function. The average between manual and power wheelchair is about $7,500. There is a large discrepancy in between the two, given their components.
So you say the difference is 75 or?
The average of a manual wheelchair and a power wheelchair is $7,500, based on the,
The manual's the same as the power?
no, sir.
You just said that.
He said the average, so if you take like all the costs for a manual and all the costs of the automatic and you average them together, sort of, or the median cost relative.
What is a
So
motorized
the
wheelchair?
motorized can cost upwards, anywhere between, I don't know, 5 and 12, depending on how it's outfitted, but on average, people don't need the supersonic one.
Okay. All right. Anybody else to speak on 241? Yes, come ahead. You're going to have to grab a chair there.
Chair, members of the committee, John Smith with the Disability Law Center of Virginia. I'll be quick. We support the bill. This funding is really needed. Thank you.
Okay, great. Yes, ma'am.
Hello, members of the committee. Chairman, I'm Terry Morgan with the Virginia Board for People with Disabilities, and we support this bill. As Delegate Adams said, it's a matter of health and well-being, but also dignity and autonomy. Thank you.
Great. All right. Anybody else on 241? Okay. Bill's in front of us.
I'll move to be reported.
Second.
Moved and seconded that we recommend reporting House Bill 241. Please call the roll.
Senator Saslaw, Senator Barker, Senator Dunavant,
Aye.
Senator Suderline,
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
Mr. Chairman,
Yep.
forgive me, but
Senator
this
Donovan.
has a fiscal impact and it's funded. Do we have to get it out of full committee? Where does it have to be by the end of the day?
No, the
George?
today only applies on the revenue side. not on
Okay,
the
only,
expenditure
not,
side.
Okay,
great.
okay.
And so
all
we
right.
can,
All right,
maybe
very
on
good.
Thursday, I'm sure we
Okay.
report and we refer to finance.
Okay, good
Thank
deal.
you.
Thank you, Delegate Adams.
Thank you.
All right, we'll go back up to the sign-up sheet. I see Delegate Byron's back here. Come on up, Delegate Byron.
Thank you, Mr. Chairman. I believe we started on this bill last week
Yes, we did.
when we were in front of you, and we just didn't have a official copy of Senator Peake's bill, which passed out of this body a year or so ago. And this is the exact version, or she will pass out the
Okay,
exact
so-
version.
Testimony already?
I believe that we did, but I'm going to give them a chance to say a couple things if they want to.
And I don't think you want any more pictures from me.
Yeah, no, I've got plenty of pictures. All right, so the substitute's in front of us. Somebody move the substitute.
Second.
Moved and seconded that we adopt the substitute for 156. All in favor? Aye. Substitute's in front of us. And based on our discussions last week and also our discussions just now, Delegate Byron, I understand this is identical to the bill that left the Senate under Senator Peake's sponsorship. Is that correct?
That is correct.
Okay. All right, so people have had an opportunity to see the substitute, unlike a little bit of a rush last week, which is not unusual for around here. But anyway, does anybody want to speak? And we did take, Senator Donovan is correct, we took some testimony last week, so let's not relitigate every point. But if you want to speak to the substitute that's in front of us now for House Bill 156, in favor, how about anybody who's in favor?
Is this a problem with, I guess, family life education? Is that affected by this?
Mr. Chairman,
Senator Donovan?
No.
I believe that's the amendment we made on the floor last year to strike that so that we were sure that it did not get involved. And regarding mental health and even reproductive rights, minors are considered emancipated and can seek that care, so it wouldn't interfere with any of that either.
All right, is there nobody speak against? Is there anybody speak? Nobody to speak in favor. Is there anybody to speak against House Bill 156, the substitute? Yes, ma'am. Come on up. Have a seat.
Hi, everyone.
No, turn your mic on for us, will you? There you go.
Hi, everyone. I'm Kendra Sutnell from Birth and Color, RVA, and we are against this bill. For one, it takes away the role of a teenage pregnancy. They come to us all the time. If it's incest, it takes the role of assisting minors with teenage pregnancy if we're under contract with VDH.
Mr. Chairman.
I don't think so. Go ahead, Senator Dillon.
In Virginia, in the code, they are emancipated minors for all reproductive care in Virginia. Birth control, pregnancy, they're emancipated and don't have to have, and can speak for themselves.
Okay. At any age?
There's no age limit in the code. Emancipated minors for reproductive services in Virginia. It's already in the code.
And can you verify which code that is? Do you know off top?
Off the top of my head, but council can.
Mr. Chair, the code section is 54.1-2969 E2.
So anything regarding reproductive justice or anything like that, it is voided that, even though this is what the amendment states. Sexual health matters.
I don't know what reproductive justice is, but for reproductive services, for birth control, for pregnancy care, for mental health services, you can read the code. They are emancipated minors.
Okay, so can you define what? Can I see your paper, please? Where it says sexual health, can you tell me exactly what we're talking about? If that's.
Would you like to answer, Byron, or would you like me to? This bill is specifically constructed for text messages and other services that were initiated from the Department of Health under contract, with a contract they had, to reach out to minors to talk about matters without the minors inquiring for the information and without parental consent.
Okay, this is a different amendment that I saw.
Okay.
But as long as it doesn't have anything to do with reproductive rights, fine.
Okay, all right.
Kathy, let me ask you a question. Hypothetical situation. 16-year-old, 15-year-old goes in and tells the school nurse, I'm pregnant. What can and what cannot the school nurse say to that girl?
Can you hear me okay?
You're right.
Okay, this, if you read line 17, this provision shall not apply to school nurses, physicians.
Yeah.
Okay,
So in
so,
other words, she could say, A, go see your parents, B, have the kids, C, get an abortion, and none of that would break the law. Is that correct?
I believe that's so. And this is really just some of those things that I showed you last week that dealt with some of the third-party contracts they had that are directing young people to various third-party groups that are not vetted and sending information out to them without the parents being aware of it.
Anybody else against? Come on up.
So, Mr. Chairman, I'm Claudia Arco with Fairfax County, and I apologize because Delegate Byron, that we thought you were offering a different substitute today. So I'm only looking at this right now. And the situation that I'm going to describe may be specific to Fairfax County because we have a local health department. So our health department employees are local health department employees for Fairfax County. They don't work for the Virginia Department of Health. And because of the way that this is written, I'm not positive that this covers our employees who are the employees who are staffed in our schools. So I understand what your intention is. I'm just not positive that this covers their conversations. When you refer to the department and what is and is not allowed, I'm not sure if that only refers to VDH and if it covers our local employees in the schools.
Go ahead, George.
Does that make sense?
Yeah.
George,
Yeah, I think that it's covered because if you look on lines 12 and 13, at the end of the line on 12, it says no person employed by the department or a local department of health.
Yeah.
So, right, but the beginning of the bill is the prohibition, is it not? And then the end is where it says it doesn't apply.
Oh, it says no person employed by.
Right.
Excuse me, Mr. Chairman. I
Yep,
think
Senator
that the Sentinel language is on line 17, where it says who are inquiring about medical conditions. And so I think that 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 they cannot initiate communication regarding subsection B, but down here, they are protected for inquiring on medical conditions, outbreaks, pandemics, state of emergency, communicable disease, or public health threat.
So,
Mr. Chair?
Yep, Senator
Yeah,
Barker.
and I think one of the things we need to get clarification on is on lines 16 and 17, where it says this provision should not apply to school nurses. In Fairfax County, the school system does not have nurses. It's the health department that provides the nurses that are in the schools. And are those nurses covered under this situation?
Mr. Chair, yes, they would be covered.
Okay.
they would be even if they're not employees of the Virginia Department.
They're still school nurses.
Correct, if they're a school nurse.
But they're
Yeah.
not employed by the school.
They're still a
district.
school
That
nurse.
They're still a school nurse.
Yeah.
And even if they're not actually a nurse, even if they're a clinic roommate, not a nurse, they would
Yes.
also be covered.
Yeah.
Okay. So this department does not refer to the Virginia Department of Health. It would refer to our local Department of Health.
Correct.
It says or local Department of Health. I think we're good.
All right.
All right. Yes, sir. Come on up.
The other half, so.
Mr. Chairman, members of the committee, Michael Malloy, Fairfax County Schools. I think a helpful clarifying amendment might be, if you look on line 12, it says no person employed by the department or a local Department of Health. That same language doesn't carry forward to line 17. So if line 17 had that same language, which was department or a local Department of Health employee, so picked up that additional local Department of Health, that would just clarify in both sections that it's referring both to the Department of Health, State Department, but also local departments.
We had that amendment.
You have a
There was
problem with
no
that?
doubt.
Kathy?
Second.
You all right? Okay.
All right.
All right. Moved and seconded. All in favor? Aye.
All right.
Substitutes amended.
That's not
Move to recommend reporting.
Okay. Let me just ask one. Is the Department of Health here?
Yes,
Okay.
Vanessa's here, so.
Delegate Byron says she's been working with you on this. Do you all, is there oil on the water here?
Come forward.
He's checking. Make sure she.
I'll move it to be reported then.
Okay.
Vanessa Walker Harris, Director of Office of Family Health Services, Department of Health. We do appreciate Delegate Byron's active engagement regarding the various versions of the amendments. I've just been updated that the governor supports the bill as amended.
Okay.
Outstanding.
All right. Very good. Senator Saslow, you made a motion?
Yeah, move it to be reported.
Second.
Moved and seconded that the bill substitute as amended be recommended for reporting. All in favor, call the roll.
Senator Sasslaw, Senator Barker,
Aye.
Senator Donovan,
Aye.
Senator Suderline,
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
There you go.
Thank you.
All right. Delegate Davis.
Yes, sir. We are back to House Bill 248, and I appreciate the additional time the subcommittee gave me, although I do think this was a perfect bill. Like our Constitution says, we should all strive for a more perfect bill, and we may have gotten there. So I think we have peace in the valley. There's been some minor changes, and I'm happy to go through what they are on the subcommittee in front of you if you would move it forward.
Okay. Tell us what's changed since you were last here.
Sure. So the first thing that changed is on line 13. This is no longer solely about carriers. It's about also healthcare providers. So it'll look at our hospitals as well as our insurance companies. We moved a couple of lines that were towards the bottom up towards the top. It's the exact same language. Doesn't make a difference. The line 19, where it says the methodology shall be designed to foster transparency. Foster transparency is a new term, but it fits and no one's got a problem. And the rest of that line was moved up from below where it was before. The one thing that I thought was very important we keep, which the insurance companies were fine with, is shall on line 22. So that stayed in there. And then we went and a couple of minor wordsmithing here and there, but nothing that changed anything in the bill. But the big thing, I think the give and take was we kept shall, and we put the hospitals in here as part of the metrics.
Great. All right. Any questions for Delegate Davis? All right. Anybody to speak on the new improved version of House Bill 248? Yes, sir.
very briefly. Mr. Chairman, members of the committee, Brent Rawlings, Virginia Hospital and Healthcare Association. Thank Delegate Davis for continuing to work with the health plans and getting us to this point. We support the measure. Thank you.
Great. Thank you. Mr. Gray.
Mr. Chairman and members of the committee, I'm Doug Gray on behalf of the Virginia Association of Health Plans. I want to thank the patron for working with me. We are going to work on dashboards for everyone, and that's what the change in adding providers in Section A means. And there's plenty of improvement to do. They need to be redone. So I'm happy we're at this point. So
okay.
You're fine with this.
I am fine with this.
All right. You okay? Okay. All right.
Mr. Chairman, I have a question.
We've gotten to the thumbs up,
Yeah.
the thumbs up testimony.
And so, tell me
Go ahead.
what you're going to report on healthcare providers that's not already on VDH?
Mr. Chairman and Senator Donovan, each of the folks who report on VHI, there are nursing homes, physicians, health plans, and hospitals have different items. They're not organized in a way that makes them like a dashboard or something that's easy to read. None of them are. They're basically lists of different things. And so the observation that I think the Hospital Association was making was there need to be some things added, and it needs to look more like a measure or a dashboard. I think the same can be said about each of the others. And so VHI's role is to do that anyway. And so this makes it clear to them that we're going to, as we form the work group, work on it for all of them.
Okay, follow-up question,
Yes, sir.
Mr. Chairman, and this may be
Sir,
to the
Donovan.
patron or to Mr. Gray, but, so what are the metrics for providers?
Well, it depends on the provider. We're not talking about creating a new metric. What
Okay,
we're
that's
talking
what I
about
wanted to understand.
is organizing what's there.
Okay, all right, that sounds great.
The work group shall have the responsibility of coming up with all the metrics.
Okay.
The only metrics that are to be required are the ones in lines 23 through 25. And then absent that, the work group shall come up with other metrics as reasonably appropriate.
Okay, and I will just point out, having a long-standing relationship with VDI, doctors have no control over what they get paid for a service. And so it's hard, it's hard for us to have comparative analysis. That'd be different if I could charge something and maybe get paid and maybe not, but I can't.
Right.
So I just think when we look at metrics, we have to look at metrics that the people we're measuring or the organization we're measuring have control over.
Yes,
So I hope that the work committee will take that into account and maybe fix a reporting issue that has been inaccurate for a long time on
And-
VDI.
Yes, Senator, and when I was looking at that site as it exists today, one of the goals of this is not to require more data to be collected or given, it's just to compile it in a manner that makes it very transparent. And when I was looking at the site on doctors, it had their background, it had the services they provide, their education. I did not have the cost per services. I wouldn't expect that will be given in the future. Like you said, you don't control
great.
that today.
Thank you so much. Thank you, Mr. Chairman.
Yes, Senator Donovan. All right, anybody speak against 248? All right, 248's in front of us.
Move to recommend reporting.
It's been moved and properly seconded that we recommend to the full committee reporting House Bill 248 and call the roll.
Senator Saslaw, Senator Barker, Senator Donovan, Senator Suderline, Senator Lewis.
Yes.
Ayes 5, no 0.
All right, thank you, Delegate Davis.
Thank you, Mr. Chairman.
All right, Delegate Delaney.
Good afternoon, Mr. Chairman. and
Yes,
committee.
ma'am. Hello.
So I have HB 1329. So this bill,
1329.
yeah, 1329. This bill adds some clarifying and technical amendments to a bill I passed in 2020 that deals with the treatment and transfer services for victims of sexual assault and domestic violence who are seeking forensic nursing care. It expands the definition of pediatric survivors of sexual assault so that it includes all children under the age of 18. It ensures a provision for forensic clinics. Not all forensic care is provided at hospitals. And it adds a representative of a forensic clinic to the existing task force on services for survivors of sexual assault.
Okay. Any questions of Delegate Delaney? Anybody in the audience to speak in favor of 1329? Anybody speak against 1329? 1329 is in front of us.
Move be reported.
Second.
Moved and seconded that we recommend reporting House Bill 1329. Call the roll.
Senator Saslaw, Senator Barker, Senator Donovan, Senator Suderline, Senator Lewis.
Aye.
Ayes 5, noes 0.
Thank you, Mr. Chairman. Thank you, committee.
Thank you, Delegate. Delegate Tran. Come on up.
Thank you, Mr. Chair. We do have some line amendments. Thank you.
Okay.
They are technical in nature, and once everybody has a copy, I can explain them and explain the bill.
Thank you.
Thanks.
They're just Roman numerals. They update two references to the Social Security Act, and we needed to get the right reference to the appropriate title.
Move the amendments.
Second.
Moved and seconded, we adopt the amendments. All in favor? Aye. Bill is amended in front of us.
Thank you. So this bill makes sure that Virginia code is aligned with federal requirements around the Medicaid program and language access. And so I think of it as, a technical bill in that sense. If we don't update our code to align with the current federal policies, we are at risk of penalties by the Office of Civil Rights. And we have DMAS here to answer any technical questions y'all may have.
Okay. Any questions, Delegate Tran? Anybody speaking in favor of 987 that passed the House 100-0? Anybody speak against 987?
Move to recommend reporting.
Moved and seconded that we recommend reporting House Bill 987. Call the roll.
Senator Saslaw, Senator Barker, Senator Donovan, Senator Suderline, Senator Lewis.
Aye.
Ayes 5, noes 0.
Okay. Thank you, Delegate Tran. All right, Delegate Helmer, you're up. Okay. So we got the full committee, and Senator Saslaw pointed out that we're really still in the bosom of the full committee, the subcommittee, so that gave you some time to work on this. Where are we?
Thank you, Mr. Chair. Thank you, members of the subcommittee. Thank you to Senator Saslaw for giving us some more time on this. So I think we are at peace in the valley. So what we have done with this bill is the posture of it now is, as if you recall, what this bill does. Oh, there is a substitute, Mr. Chair.
I'll move the substitute.
Second.
Thank you.
If you recall, this was the bill that provided for price transparency. There was a lot of discussion about both compliance and then also about a price estimator tool versus a list of 300 standard shopable services versus the standard charge list. What we have done is essentially codified the non-controversial component about this, which is the standard charge list, aligned it with the federal code, and I think everybody feels like there's half a loaf here. So. I know I don't want to speak on anybody's behalf because I know this has been controversial, so it might be worthwhile to just have everybody give you a thumbs up.
Well, first of all, any questions from the subcommittee for Delegate Helmer?
No, sir.
All right. Let's hear from, let's start with those who are in support of the revised, new and improved 481. Anybody? Well, I know, yeah, come on up.
Mr. Chairman, Julie Dye with BHHA. We do appreciate the extra time to work on this piece of legislation. I do believe that we are to a place where we can be neutral and not have any additional concerns about the bill.
Great. Okay. Anybody else? Come on. Come ahead. Don't be shy.
Thank you, Subcommittee. My name is Marnie Carey. I am the president of Power to the Patients. It's a national nonprofit organization that's exactly dedicated to this issue of getting price transparency for patients. And I'll tell you, I came here loaded for bear, ready to convince y'all that this is something we really needed, and was so grateful. When I got on the plane, we were in one place, so when I got off the plane, we were in another place, and I'm very grateful that we have found peace in the valley, and I think it's a great step forward. Is it perfect? No, but that's what agreements are all about. Nobody comes away with everything they want, so I support it, and I'm glad to see that it's
Chairman.
Senator Suderline.
So where did you fly from?
Orlando.
And do they actually say peace in the valley there?
No, that's a Delegate Helmer line.
Thank you, Mr. Chairman.
All right, next.
You flew up here just for this bill?
Yes, sir.
You have no life.
Thank you, Mr. Chair. Thank you, members of the committee. Elliot Fishman from Families USA. We're a national advocacy organization in Washington, D.C. From Washington, D.C.
Families USA.
Families USA. We're a consumer advocacy organization, and this is really a consumer issue, both in terms of transparency for consumers, but also because they have a stake in the competitiveness of the market. And lack of transparency on prices really inhibits the purchasing of healthcare. And it also inhibits the consumer protection function for the Commonwealth of Virginia as a regulator of insurance, as a regulator of hospitals. So this really operates on multiple levels. And it's very important that the state act on this and not defer to federal enforcement, which has been problematic, and that empowers the state in its regulatory functions, both for healthcare and for health insurance.
Okay, great.
Thank you.
Thank you. Next. Yes, sir.
Hi, my name is Dr. Keith Berger. I'm a practicing gastroenterologist in Virginia Beach. It's a couple hours from here. I operate a independent, one-bed, outpatient endoscopy practice, and I've been doing this for 41 years. We provided price transparency and really lower cost of doing procedures in the office versus if you look across the street, the same procedure costs $4,000. It costs $400 in my office. So I've seen the impact of this disparity and uneven ground in how it affects practice and access to services, and I think this bill is a great start.
Great.
Thank you.
Where's your office?
I'm right next to Virginia Beach General Hospital on First Colonial.
Next.
I'm Dr. James Tinsley, Newport News, Virginia. I am a solo family physician, been solo for about 3 years. I get health care for people who've been disenfranchised by the system. Disenfranchised, either they don't have access to care, can't afford to wait 2 weeks for a visit, or they've been priced out, and many have been priced out. I had a lady pass away yesterday. She had cancer diagnosed 2 weeks ago. She could not afford a CT. So we're not dealing just with dollars and cents here, guys. We're dealing with lives and human suffering. So this is a very, very important bill. I appreciate you guys taking this up and pushing this forward. And I would really appreciate when other bills come up, like the certificate need you guys took up in the past, that you reconsider. You're really hurting the citizens of Virginia by not pushing things like that through.
Okay, thank you.
You're welcome.
All right, the new revised House Bill 481 is in front of us.
Move to recommend reporting.
Moved and seconded that we recommend reporting House Bill 481 as amended. Call the roll.
Senator Saslaw, Senator Barker, Senator Donovan, Senator Suderline, Senator Lewis.
Aye.
Ayes 5, no 0.
There you go, Delegate Helmer.
Mr. Chair.
We have, we've got one more bill on the docket, but we don't seem to have a patron. Have you heard anything from? Oh,
We got Delegate Williams.
oh, I didn't see it. I'm sorry.
Thanks, sir.
I'm sorry. Fine undergraduate education, too. I'll say, there it is. Okay. Sorry about that, Delegate Williams. Go ahead.
No problem. Thank you for having me. Yeah, I've actually, can I pass, I'm going to pass these out. They're the same thing you got. I've just already put them together, if that's okay. Here you go. They're packed up together. Yeah. Yeah, so let me explain.
I'll move Delegate Williams substitute.
Second.
Thanks, guys.
All in favor?
Wait.
Is it the one from the House? Did you substitute in the House?
All right, so I've got the one from the House, and it says House substitute. And this one started out as the contract.
Which one do you want?
Can we put them together?
Well, we do.
No.
Just then, I'm okay with the substitute, and y'all can pass the substitute because
The substitute you're offering to us today?
Yes.
Okay, so it's been moved and seconded. We adopt the substitute. All in favor, say aye. Aye. Substitute bill for 1305 is in front of us. Okay, Delegate Williams.
Thank you, sir. What this does is it would allow the Patrick County Hospital, which was closed back in 2018, to return to an operating status using the COPN licensure process if they open up the same kind of hospital as we had in Patrick County in 2018, which is sort of outlined there in the
Mr. Chairman?
12 through 20 lines.
Can Delegate Williams please remind us, we spent a lot of time with Senator Stanley
Yes.
trying to help him on this. Can you bring us up to speed on what's the situation?
Sure. Yeah. So Patrick County lost its hospital in 2017. The license was continued for 1 year. Ralph Northam helped with that, and but ultimately it closed in 2018. We've been trying to figure out something to do for healthcare there, but now we've actually got some traction with potential buyers, and they're interested in bringing a hospital to Patrick County at the same facility. The goal of this would be to alleviate extra burdens that they'd have to make sure X, Y, and Z to get this thing done. It's sort of streamlining and making more efficient the process for us to reopen the hospital. I hope that explains it to the Senator.
All right, thank you. Thank you, Delegate Williams.
And there's others here to speak in support of it.
All right, who have we got in support? Julie?
A quick question.
Oh, I'm sorry. Yeah, any questions from the committee?
Yeah.
Senator Barker.
Yes. Would this hospital, particularly as it relates to the 25 beds, would this hospital be seeking federal designation as a critical access hospital?
Yes, that's what we were before, and we'd be seeking that again.
This house was, Mr. Chairman.
Senator
This
Sasslaw.
house was got a total of 25 beds.
Yes.
Does that stay in existence?
Well, the way it I can answer that question. The way it stays in existence is that if you're designated a critical access hospital, you can't have more than 25 beds, and you can't have a whole slew of services. But because of the economics of the situation, they get reimbursed at cost, which is significantly higher than what the normal reimbursement is. And in the case of this hospital previously, nearly all of the patients were Medicare patients.
Correct.
So there, and what you had was a situation where people who lived in Patrick County, who were on Medicare, a lot of them went to this hospital. The younger people in Patrick County went elsewhere for services. So
that's right. Now we don't have anything. So
now everybody has to go.
Yeah, and to go back even before 2017, the hospital in Patrick was profitable, but its parent corporation in Mississippi ended up filing bankruptcy, which caused our foreclosure.
Yeah, and I think we have about 7 or 8 hospitals around the Commonwealth that are critical access hospitals that are a significant distance from other hospitals, don't have a large population in their service area, and don't have more than 25 beds. But because of the reimbursement benefit that they get under Medicare for that, then they are able, in some, not every instance, to be able to survive. But it's what puts all of them with at least a potential for being successful financially.
Yes, sir.
All right. Julie, do you want to say something?
Ditto.
Okay. Ditto's fine. Ditto's fine.
Yeah, we are very supportive, Mr. Chairman, members of the committee. I'm very supportive, would love to see this hospital reopen, and appreciate all the efforts from Senator Stanley as well as Delegate Williams. And this really just puts it back where it was, where it like it's frozen in time, so would allow them to continue with their COPN as if it never left.
Okay. Great.
And I have the Virginia Department of Health there too. I've been working with everybody, so they're all.
Let's do it this way. Is there anybody opposed to 1305? Okay.
Move to recommend reporting.
All right. Been moved, properly seconded. We recommend to the full committee reporting 1305 as an amendment in the nature of substitute. Call the roll.
Senator Sasslaw, Senator Barker,
Aye.
Senator Donovan,
Aye.
Senator Suderline,
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
Great. Thank you, Delegate Williams.
Thank you all.
All right, we've got one more bill on the docket, but I have been informed that Delegate McQuinn will not be able to join us, so I assume that just bumps it up to the full committee, right? We can do that? Okay. All right, Senator Barker?
I thought based upon what...
What'd you say?
I thought based upon what Senator Saslaw had said last week is that if something was on our docket and we did
It
not
stays
make
with
a
us.
regulation, it stays with us. So therefore, we got to figure out.
Well, whether the bottom line is we can't make her materialize. So.
That means they didn't look
I've seen two this year that were 100 to nothing that had.
Right.
Yeah, and there's
Right.
some trouble with this one.
All right. So it stays here.
All right. We'll figure it out for.
All right.
All right. We're adjourned.
Okay.